This is a CJSON podcast, and I'm Dr. James Lan from the University of British Columbia. On behalf of my co-authors, I would like to present the results of our study, Pretransplant Calculated Panel Reactive Antibody in the absence of donor-specific antibody and kidney allograft survival. Immune risk stratification is essential to optimize the management of kidney transplant recipients. Calculated panel reactive antibodies, or cPRA, is a metric which was developed to inform the likelihood of finding a HLA-compatible donor for transplant candidates. However, over time, cPRA evolved to be used as a key factor to guide immunosuppressive protocols in both clinical trials and practice. The validity of using cPRA as an immune prognosticator for post-transplant outcomes is uncertain. Our study objective was to determine the clinical relevance of cPRA in the absence of pre-transplant donor-specific antibodies. We conducted a retrospective observational study of 4,058 adult patients who received a living or deceased donor kidney transplant in the United States between January 2010 and October 2014, with follow-up through October 2017. Because it is difficult to classify pre-transplant donor-specific antibody status using registry data, we restricted our analysis to recipients matched to their donors at the major transplant loci, HLA-A, B, DR, and DQ-beta-1. This study design allows us to determine the association of cPRA with transplant outcomes independent of preformed antibodies to these HLA antigens. Under these study conditions, we observed that cPRA up to 97% was not associated with a higher risk of transplant failure. The higher risk of transplant failure associated with cPRA equal or greater than 98% was limited to repeat transplant recipients. It was also not observed in patients who received a living-related kidney transplant. In summary, we found no association between cPRA less than 98% and transplant failure in patients matched to their donors at major HLA loci. Whether allograft survival is also independent of cPRA in patients mismatched to the donor at major HLA loci requires further study. Our study challenges the use of cPRA as an indicator of immune reactivity in the absence of donor-specific antibodies to major HLA antigens.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.